Yesterday, the Ontario government released the next phase of its plan to stay open healthcare strategy. This is ahead of an anticipated rise in respiratory illnesses in the fall.
So for more on this, we're joined live now by Dr. Dick Zoutman, professor in the School of Medicine at Queen's University. Thank you so much for joining us this afternoon to chat about this. Now, critics of the province's new 5-point strategy plan to stay open, their plan say it mostly addresses furniture and moving people around on that furniture, but nothing to really tackle the serious nursing shortage and crisis, nurses who need to attend these beds. What's your take on that? Do you agree?
I absolutely do agree. I've been the chief of staff of 2 of Ontario's large hospitals and been in the system, for 42 years. I've never seen it like this. We're in a terrible crisis. It starts with the fact that we should have attended to the health human resource crisis a long time ago. This isn't news. It's been coming for a long time internationally, and there's been nobody in charge of trying to do the planning. So now we're stuck. The other problem is that the COVID pandemic has caused huge damage to our healthcare personnel. It's wiped out so many people who were going to work in the system, who've gotten out, who've gotten sick, who are getting sick still. Because we don't have the proper things in place, like wearing masks in public spaces and all those other things. Our uptake of the 3rd dose of the vaccine is pretty poor. So that just means more people are coming into the emerge, more people are coming into the hospital, the healthcare workers are getting sick, and we have a terrible crisis throughout the system. You see it first in the emerge, but it's throughout the entire healthcare system.
Doctor, can you elaborate on sort of the complexity of, the answer for this? Because you have the grass is always greener on the other side, the U.S. healthcare system, the Swedish healthcare system. What is the answer?
Well, we should have been on this sooner, but that doesn't help us now, does it? A couple of things. One, the plan that the government has put forth is, quite frankly, not enough. And, if you just take into consideration the number of healthcare workers that we need is not 6,000 in terms of nurses. We need far more than that, 30,000. So, we're filling a quarter of the gap, offering free tuition to nursing and allied health students so that they get in, making sure that they have the security of being able to graduate without having, a huge debt, and that will attract our brightest students into these professions. We also need to bring in the international graduates who are available but waiting. Now they're making some effort, but again, it doesn't seem like it's nearly sufficient. And we need to protect people from COVID across the entire community, so we don't have, so many of our beds taken up by patients suffering from COVID, which is largely now preventable if we did the right thing, and we're not. We dropped everything on March 22nd. It's nuts.
Okay, it sounds like challenging times lie ahead. According to you, Dr. Dick Zoutman, professor in the School of Medicine at Queen's University, appreciate your thoughts and time this afternoon. Thank you.
My pleasure. Take care.